Hello, everybody. I'm Kara.
I'm Bevan.
I'm Audrey.
I'm Dana.
And we are the
Squirrel Squad.
All right, here we are, our first official Squirrel Squad Zoom call. We've been talking for months about how to even get started because we are squirrels. So, it takes us a while to decide. But here we are, perfectly imperfect. And we're kicking it off with myths, ADHD myths. What are the myths that we hear that are out there and that people don't understand? And so we're going to talk about them and bust some of them and discuss and see what comes out of this. So I'm starting today with, doesn't everyone have a little ADHD? Or the other one is, well, ADHD is just an excuse. Oh, all right. Just in the last 6 months, I cannot tell you how many times I have heard one or both of these statements. Everyone has a little ADHD. So starting with that, no, I get everyone does have moments of forgetfulness or being distracted or not keeping track of time, all these little pieces, but no, everyone does not have ADHD. And when I hear that, and we can talk about this, to me, it feels like it minimizes a very real piece of our brains and our children's brains. And I'm not saying, going to the, it's just an excuse piece, it's not an excuse, but it's an explanation for the challenges that come along with this uniquely wired brain and how the chemistry works and how those distractions can interfere. And so put it out to all of you. How do you feel about everyone has a little ADHD? It's just an excuse for behaviors.
I hate it. It makes me mad.
Yeah.
You're right that everybody has those tendencies to forget something or misplace something or be unorganized, but it doesn't affect their daily life every single day, right? That's a huge difference. This affects our way of life. It minimizes what we're going through, as you just said, and it's a very real, well, it's also a diagnosis. So hello, medical world. But yeah, I think it minimizes what we're going through. And I think it doesn't share how that importance of having it affect you, right? It's a constant affectation you have to deal with that makes it hard in life. Can make it hard in life.
Yeah. I think too that it's the, when there's a visible disability for someone that we're not, if we were to say, oh, well, we're all a little blind sometimes. Okay, my eyes are not great. They're not, but I cannot know what it's like to live as a blind person, right? It's not the same. Yeah, my eyes don't work like they did even 10 years ago, but I can't relate to that feeling. So ADHD it's a lifelong diagnosis, and we might learn how to work with it over time, but it is a very real diagnosis.
Yeah.
Audrey.
I think one of the dangers of this myth is that it gets in the way of diagnosis or getting support because it minimizes the struggle. And so I think that's where it's really dangerous, because I think sometimes parents also might have this, and I think a lot of times moms find out they have it, but they haven't been diagnosed. And by justifying what it's like for them, they maybe then won't look into it for their kids. And I think that's really unfortunate for their kids, but also for themselves to have that understanding and to be able to get the support that they need to do better. And if they actually have it, Yeah.
I
think
feel like
that's-
this has been said to me so many times. And as a mom of 4 kids, everybody does have a little ADHD in my household, including mom and all 4 of my kids. So yes, in my household, you can say that. But when it is said out in the general public, it used to always make me feel, well, it still does make me feel really uncomfortable.
Mhm.
And I used to just kind of laugh it off and just kind of take it as kind of like, they don't know what they're talking about, hee hee. And I just, don't want to be unkind or rude, and I want to be nice, and not give into my impulsive desires maybe to say something. But I have started to change that, and I have started to respond nicely, but actually no. And if you want me to explain why that's not true, I'm happy to explain it to you. Sometimes people have said, yeah, explain it to me. And I feel like I can do my part to try and help people understand, and also share that, like, just so you know, people who have ADHD don't like hearing that. And I know it's not meant in any way to be, unkind, probably meaning to connect. But at the same time, it's important for people to also recognize that just like we've all learned to stop saying things that we didn't know maybe at one point or time was unkind or offended someone, or perhaps airing some of our biases. I
Yeah.
think it's important for us to stop this myth because it is harmful.
Agreed.
Absolutely. Yeah. Thinking about, Audrey, what you were saying, where some people think that a diagnosis is just an excuse. And so a parent thinking, oh, well, we can't excuse the lazy behavior, or that's, my kid is just being lazy. And that's another one at some point, but that it kind of ties in together, is because that was one I heard, well, he can't use ADHD as an excuse for talking out, or for not listening to this, or for doing that. And it wasn't about that. It's how can we work with this brain and his needs to help him learn the way that he needs to learn. So no, it's not an excuse. And it's important to understand that the neural pathways, the way our neurons connect, that how information is passed through the brain, that some of those connections aren't very strong yet. And this is the ADHD brain, where it takes longer for those connections to be made. And so understanding that with our kids, understanding for ourselves, if parents are not diagnosed, but maybe they should be diagnosed, or maybe they know, you don't have to. If you think, you know what, my kid was diagnosed, I think that I have ADHD, just had that awareness of, I should probably learn more about ADHD. And I think that that's kind of what we want to bring in here is, one, let's destigmatize an ADHD diagnosis. It's not a bad thing. It gives you an opportunity to learn and grow. And then to start learning language around ADHD, understanding the myths so that you can educate others. Bevan, I loved what you said, how now you say, well, no, that's not true. Would you like to hear? I'm happy to share. And I think that's important. So I think for anyone watching, if they ever come across, well, doesn't everyone have a little ADHD? Or, oh, ADHD is just an excuse. Having some information in your pocket of, well, actually, and resources like Chad and Ada are wonderful for finding accurate information. And I'll just put a plug in, How Do ADHD. I love Jessica McCabe. So people can relate to her. She's got just good energy. So even if you just point to, or Squirrel Squad, come here and we can share more about it and point them in our direction. All right.
Yeah, I think
yeah.
I think what you just said just before we go is that's really important, is it's not an excuse and it is an explanation.
Mhm.
So I think both things are true. And I think it's really important, for instance, that it's not a pass for bad behavior. You have to have expectations of your kids, but make sure your expectations are in the right place. Make sure they're ones that the kid can meet, as opposed to setting them up for failure. So if maybe it's okay for them to get up from dinner if they're done, maybe you let that go. Maybe you tell your friends he's not being rude, he's taking care of himself, he needs to put on earphones or something, right? Like it can be an explanation without it being an excuse.
Absolutely.
Well said.
Absolutely. So let's talk about another myth. So maybe we can go into Dana. Only boys have ADHD. What?
I
Tell
know,
us.
only boys, only boys.
You can't have it.
I don't have it, no.
Wait a minute.
Yeah, boys do get ADHD. Yes, they do. So do girls. And yes, contrary to popular opinion, girls even can have hyperactivity as part of their ADHD. So boys are diagnosed 3 times more than girls are. But that doesn't necessarily mean that the guys are 3 times more likely to have it, right? So those are different stats. And unfortunately, girls are often, they fly under the radar. They're undiagnosed, they're misdiagnosed because they do often, either because they have inattentive ADHD instead of hyperactive, but even if they have hyperactive, it's not seen the same way because it doesn't manifest the same way. So maybe in class, the girls are chatting to each other too much. Okay, teacher's just going to be annoyed. They're not going to do anything about that. The boy who's jumping up and down and running around and doing whatever he's doing because he can't sit still, that's going to catch attention. So they're going to be referred a good 50% more times to be diagnosed than girls are. So we're already behind the 8 ball there, right? It manifests differently. It's always been based on the manifestation of boys, because in medicine, with anything else, right, just has a history of that's what things are based on. So it's not true. Girls get it. Girls have it. I would say that what is hard for girls and women about the diagnosis part is that because we manifest differently and because we're brought up differently, right? So there are different societal expectations as well. And we can't just pretend that's not true. So girls are taught pretty early on, sit still, be quiet, be polite. Okay, so they do all that. They're masking really early, and they mask more than boys do. They also internalize all of the struggles more than boys who externalize it. So all of these things cause it to go under the radar, and even parents won't necessarily see it. And certainly teachers and schools, if girls are perfectionists more than boys are with ADHD, which they are, that's one of their manifestations. How do you recognize that as a teacher when what you're taught is, if you're taught anything, ADHD looks like this, right? So I get why people think that, and it's just completely wrong.
Yeah.
What do you guys think about it?
Well,
Oh,
maybe-
also, let me add one more thing I forgot to say, which I started to say, which is that when we're misdiagnosed, that's often to anxiety, a mood disorder, depression, because that can come from 2 different things. One, how we manifest, but also hormones, which make a difference. And so girls get moodier because of both hormones, and those hormones exacerbate the ADHD sometimes. So you've got that extra thing thrown on top, where if we do have struggles, it's seen as emotional, and emotional doesn't point to ADHD to many people. It points to anxiety or depression or a mood disorder. Okay, sorry. Up for grabs.
No, that was important. Something I was just going to add to that is when we were at the ADHD conference in the fall, they were talking about how 1% of the studies on ADHD have been including women, which it's like only boys have ADHD because you only study boys. There are just so many problems with that. And finally studying girls, and as you mentioned, the hormone cycles and how that affects dopamine levels. I think there's still so much that needs to understand ADHD with girls, but I guess the other thing I'd add is just like, it's hard to see sometimes where the busyness is inside instead of outside, the overactivity of the mind.
Absolutely. I mean, yeah, it's the rumination inside too, right? And the going rapidly, and then they may fidget. It's not like they don't fidget. It's not like they don't tap feet, you know, and some manifest with pure hyperactivity. Like
Yeah.
let's not pretend that they don't, but it does make it more understandable that people feel that way because it's just not seen as easily.
Mhm.
And we work hard at not keeping it
Right.
down, right?
Covering it up. Yep. One thing
Yeah.
with my clients is I see a lot of skin picking in the girls.
Yes.
As a way that they, yeah, that can manifest.
Yeah, there's more self-harm in
Mhm.
girls too.
It's really sad.
I think in addition to like the lack of studies, I can't remember the exact timing, but like different name for this condition was shown since the 1700s in medical journals, but only acknowledged in girls, I think 40 years, right? So
I think.
for how many centuries was yes, this is only a condition that exists in boys. So I think it's one of those things that like we're still pushing up against just a huge lack of knowledge and a huge just thought about this, that even though it's been many decades since girls have been included in this diagnosis, it still takes such a while, I think, for society to catch up to our thoughts around that. I think having, as I already disclosed, multiple kids with ADHD, 3 of whom are girls, and my youngest having a big H. So she definitely has not just the inattentive. My experience with her and how she's perceived by the world, it's much more with thoughts around her behaviors being a choice. She even had an administrator in the past say, you know, you just need to choose to pay attention.
Yes. Yes.
Wouldn't that be nice? And again, this was, you know, administrator who'd been in the education field for, gosh, I think 50 years or so, maybe more. And so again, it's just looking at this little whirling dervish as a behavior problem versus possibly we were in the process of getting her diagnosed. So we didn't have an official diagnosis, but it didn't take a diagnosis to just know exactly what we were dealing with here. It was just a matter of paperwork. Nevertheless, the assumption was just a behavior problem. And I think what I've noticed in my 3 girls is how much the outside world perception affects them emotionally. And I don't know exactly the studies. Maybe Dana, you do because this is your topic, but how much all that, the negative, the criticism
Huge.
impacts girls versus boys, and that lack of diagnosis or late diagnosis and all those years of not knowing. That's a huge concern.
Yeah.
Yeah, there's absolutely the girls tend to, again, internalize everything. So that's not just the manifestations, but it's also they internalize how people react to them more than boys do, right? Boys are more likely to push it to somebody else, to have a little bit of otherness. And girls do not. We take everything on ourselves. Like it's my fault. We mask super fast because we don't want people to see that we're fidgeting or we're doing this or we're doing that. We're also diagnosed so much later. So the average age for girls is 17 compared to the average age of 8 in boys. That's a huge difference. So that also means that for all those years, doesn't mean that we don't have it until then, which it does start later in girls too. It can. So it used to be that they'd say 8 to 12, and they've kind of enlarged that a little bit now to incorporate that girls do start later because of hormones. But yeah, it's terrible because there's more picking, as you said, Audrey. There's self-harm. There is more depression, anxiety. So again, whether that's misdiagnosed or added on, right? All of that comes for the girls, and that makes it really, really hard. And girls are so much more self-conscious anyway because of social media and things like that. So it just feels like it's a pile on. And to then try to say that they don't get it and they don't have it and it's a choice is just, it's really sad. And it really hurts. You know?
Yeah. So I'll just add on a little bit because I want to get to our next myth, but I was looking at some of our notes from the International Conference on ADHD, and
Great.
one of the talks, just the talk about what you've talked about, the anxiety and depression, they tend to be diagnosed first, that they tend to suffer silently. It's more inattentive type. They're at a higher risk of peer rejection. because misreading social cues. 1 in 3 girls seriously considered suicide in the last year, and which was an increase. They're at a higher rate when they have ADHD. Undiagnosed and unsupported ADHD increases risky behaviors. Social media, girls on social media, they're at higher risk. There's, you mentioned masking, and I don't know that everyone knows what masking is, and maybe that's something, that's another topic, but real quick, you kind of alluded to it, just the pretending that we're someone that we're not, pretending that we've got this handled, where everything's okay. It's, showing up in a way that you think people that you want them to see you. And that's not dealing with
fit in.
Yeah, to fit in. That's the word.
Fit in.
Yes. So anyway, masking is, we should totally have a talk one of these days about masking, because that's a big topic. But anyway, those are some of the things. I could keep going on these notes. Oh my gosh, what you said, there's so much that we don't know about girls because of the lack of research, because it's all been so boy-centric for decades and decades. So,
Yeah.
but I think it's a good topic too, to go into the next myth, which is, I think, Bevan, your myth kind of ties in really well with this. What is your topic?
Should I take it away?
Yeah, take it away, Bevan.
And my myth is that kids will outgrow ADHD in adulthood. That's a common misconception, that ADHD is a childhood disorder. And I think that's largely because it most often is diagnosed in childhood. So people kind of associate it with being a childhood issue. And a lot of people don't realize that ADHD symptoms can continue to persist in adulthood. They just typically manifest a bit differently, kind of like boys and girls. They manifest differently, same thing between children and adults. So this myth is false, and the 4 of us are nice evidence of that, at least a sample size. Keeping in mind that ADHD, it is rooted in a neurological difference. And while our brains are very plastic and can have a lot of rewiring and a lot of impact through, specific therapies, interventions, supports, it's still a neurological difference that persists. And again, impacts daily functioning in life. So some things, I think this myth is out there because the way in which the symptoms manifest, again, can shift over time. So it's more common for things like hyperactivity to diminish, or at least a person knowing how to kind of manage that aspect of their ADHD. However, other symptoms sometimes become more pronounced in adulthood, particularly the inattention and impulsivity piece. And that has to do a lot with just the increased responsibilities and demands of adulthood, jobs, children, marriages, money, having to adult. So it just becomes that much more evident, I think, as adults, particularly if you've not been diagnosed and you're starting to wonder what's going on. Or if you were diagnosed as a child, but maybe didn't recognize all of these symptoms that actually were a part of your ADHD. Also, it's come up a couple of times already as we were talking, coexisting conditions. So sometimes people have been diagnosed when they're younger with maybe a learning disability or something like anxiety and depression, and not realizing that part of their profile also includes ADHD. So sometimes people kind of forget, oh gosh, they all go together, and there's such a common connection between, ADHD oftentimes does not come solo. So sometimes people are more focused on the things like anxiety or the depression or other mental health conditions. And again, not recognizing that, oh yeah, that ADHD piece may be a big piece of why those other things in adulthood are highly impactful. Again, ADHD, we know, highly genetic. And so a lot of times adults don't get diagnosed until their kids do, as we already mentioned. It didn't just appear when your child got diagnosed. It was likely there all along. It's just your child's diagnosis that was like, oh, that was me. And, I think, why do we still have this myth around the stigmas around mental health? people not wanting to talk and share. We're trying to change that, Squirrel Squad, and be like, hey, this is a real thing. It persists in adulthood, and we have some unique challenges because of that. The lack of awareness. And then also, again, the way in which it presents as adults. Sometimes people are more, gosh, that parent is just always late. They're just like so careless. So, always tardy, always tardy. Well, why do you think? I feel like I should be high-fiving all the ADHD parents that drop off always 5 minutes late. It's just a unique challenge that's ever present, and always trying to work against the things that are a little bit more challenging. Diagnosis, it is challenging. We don't have a test that is super easy. And so a lot of times people, again, kind of just assume that these symptoms are just like, oh, a personality problem versus actually a diagnosable condition, but we have challenges with that. And then lastly, I just want to mention that there's also cultural and society factors and biases. There are, cultural beliefs, there's societal norms that sometimes will influence our perception of ADHD versus like, oh, it's just that kind of a person or that group of people. It's important to recognize that the bias and the prejudice that exists when it comes to lack of diagnosis of ADHD across all ages, including adulthood. So that's my kind of take on all of that. Yes, it exists. Yes, it at times sucks. Yes, at times I'm super glad that I have a very creative, superpowered brain, but I am still, many decades into my life trying to figure out how to work with my ADHD as an adult. Yeah. Thoughts?
Yeah.
Oh my gosh.
I think one of the things, oh, sorry, go ahead, Kara.
Zoom, it's hard to, I was going to say, so how many of you, someone asks a somewhat simple question and it takes you 5 minutes to answer, because the answer, you've got to like tell this whole story to get to that very simple answer? Is it just me?
No, never.
No, it's not just you.
Someone was talking about the weather the other day, literally the weather, and it was cold or something. And I literally went on this whole story say, and yes, what I was getting at was it's cold.
Or the trying to connect with another person by sharing a personal story that you can relate to the story, not to realize until probably a little bit late in life that many people find that annoying, or indicating that like, oh, I'm just on an ego trip and I want everything to be about me. So recognizing that aspect of ADHD was helpful, because I'm like, oh, okay, so I have some social skills to work on.
Social skills are, they're important. Also that flakiness factor, right? That's often, as an adult, if you're running around or you're time blind, so you're not showing up on time, or you're forgetting things and pulling things out of your bag like this, right? A guy might be, oh, well, he's got so much going on. And for a woman, it's like, it's a little flaky. Like, really? Okay, thanks.
Yeah. I think in adulthood, it is as a child too, but in adulthood, it's a lot more like moral failing. It's kind of labeled as like, if they cared more, if they tried harder, if you wanted to be on time, you would be. If our friendship was important, you would do this. And that's, that can be really hard.
And why we need to communicate, share our experiences, help people understand. And again, it's not an excuse, it's an explanation. And we can rely on our close friends and family to be part of what helps us function better. Can you just always be the one that picks me up? Because if I'm having to like get myself together and go pick you up, I'm gonna be late. And I know that bothers you. It bothers me too, but like maybe more you. So let's work together to make this work. A friend recently did that very top. A friend recently, let's go to this thing together. I'm like, sure. Do you want to come in my super messy, gross car? Totally happy to drive. She's like, let's go in mine. I'm like, awesome.
Takes a village, even for adults.
I want to shoot it over to Audrey before we run out of time and hear about your myth.
My myth is bad parenting causes ADHD.
That's a myth?
Dana!
I thought I did it all.
This is one that definitely parenting my young kiddo, I I realized it was a belief that had been maybe passed on, or through, whether it was through family or society, that if your kiddo's acting out, if their behavior isn't good, that it's something about your parenting. And if you're a better parent, you'd have a better kid. And that is false. False, not true. And you can kind of, like, if you look at the history of ADHD, you can kind of see where it started. Like in 1902, a British pediatrician called it an abnormal defect of moral control in children. So that's where we get back to that morality, like, oh, there's something wrong with their morals. Like, oh, that's not great. But then he labeled it hyperkinetic reaction of childhood, which in some ways maybe is better than the definition we have today, because well, for the kids that move a lot. But it's really crazy to think that it wasn't labeled until the 60s as a mental disorder. And that was in the DSM-2. But before that, it was really actually kind of considered bad parenting caused this. And at that point also, the idea about behavior is that there wasn't emotion, like, not to consider what's happening inside of a person. You just, it's like reward or punish behavior, and what's happening inside doesn't matter. So you can see why it's like, okay, if you think behavior is only something on the outside that has to be either punished or rewarded, that you can see why some of these ideas were passed on. And then it wasn't until the 80s that it was labeled ADD, with or without hyperactivity. And so, Devin, when you were saying 40 years ago, and I was like, no, it was the 80s. Like, oh no, that is 40 years ago. That's weird.
Man, that's really weird.
Yeah.
It's super weird. But I think, as we've, I think hopefully as a society are becoming more emotionally aware, or learning more about emotions and how to process them and handle them in healthier ways, I think we can learn ways then to help our kids through their big emotions, because kids that have ADHD often have a lot bigger emotions and more, big emotions, higher resistance, a higher need for autonomy, and can be more impulsive. And I think we all have experienced that punishing or rewarding does not work with these kids. So they actually do need to be parented differently. Like, criticism, shame, and punishments don't work. And so it's not bad parenting that causes it, but you do need to change your parenting to support it.
Yeah, parenting can exacerbate, how you parent can exacerbate those systems or make them better, like routines and schedules and, yeah, totally.
I'm also thinking about, like, in terms of like, oh, bad parenting causes ADHD. I'm also thinking about, like, some of the, is it food dyes? Is it too much sugar? Is it their diet? And this judgment that gets put on parents that, like, did your kid have sugar today? Well, like, yeah, okay. Yeah, my kid had some sugar. It's like, oh, she's no wonder you're a kid. And I'm just like, you know what? Can we just calm down on the judgment a bit? Childhood, ADHD or not, if a kid wants a cookie, give them a cookie. It's not that impact. I mean, it can be if a child is fed sugar all day long, in which case, again, no judgment, didn't cause the ADHD. Yeah. But again, a little bit different approach to parenting, thinking about what our kids are feeling on, but definitely that. And then just the kid just needs more discipline.
Yeah.
Right. And noticing that the correlation is not correlation.
Sorry, go ahead.
I was just going to say that it's important to remember that correlation and causation are not the same.
Yeah.
And I think,
can I say one more thing about Bevan, and then you go, then take it away. Bevan, something you said just made me think, like, just like bad parenting doesn't cause ADHD, perfect parenting won't prevent it.
Mm-hmm.
Right? Where you can try to have the perfect bedtime and the perfect diet and the perfect everything. If they have ADHD, they're gonna have it.
Absolutely.
Yeah,
oh my gosh.
Totally.
I thought growing up that my parents just didn't know how to parent, and that's why things were difficult in our house. And I thought, oh, well, when I become a parent, I've got this. I was an elementary school teacher. I knew what I was doing. I could handle kids. No, They are, so the perfect parenting, my kids went to bed. We were very careful about the foods we ate. We got them outside. We were active. No. But I think too, a challenge can be is because ADHD is genetic, most likely at least one parent has ADHD, and how that affects the consistency in the home. I hate that word. Consistency is like,
Hmm.
because I can't freaking be consistent. It's impossible in some areas. Some things, if it's important enough to me, then I dang it, I can't think off the top of my head what that thing is that I do all the time, but I know there's something. I brush my teeth every night. I brush my
Thank
teeth
God.
every morning. I brush my teeth. But other things, it's hard when you have ADHD. And this will be a topic for another day about, the rewards part of the brain and just how that all works. Anyway, being a parent with ADHD, parenting kids with ADHD, it's not going to be perfect. And we do the best that we can with the tools that we have. And if anyone is like me and finding out you have ADHD after kids were diagnosed, and then trying to figure out how do you parent these kids, and the number of books I've read, the conferences I've attended, the webinars, the podcasts, all the things to try and become the best parent I can be. And so when there's that shame put on me from another parent who doesn't understand what actual ADHD is.
So hard.
Yeah.
So I hope what our listeners, watchers here end up getting from all of this is that you are not alone. We are here. We get this. We feel it. It's not that you're a bad parent. Can we all get better? Do we all make mistakes?
Yeah. Hello.
Yeah. All the time.
Do we yell? Hello.
We're not perfect, but we're trying to learn more, to advocate, to grow ourselves, to help our children. And maybe they'll be better parents than us. I hope so. Hopefully, instead of going backwards, our kids go forwards. But all these ADHD myths, there are so many more we could go into. And there's so
many.
So much that we could take just from this little short bit that we could pull apart and get really squirrely on.
Another
But
day.
I know we're
another
just
day.
out of time.
But we are going to save that for another day. So you have something to look forward to, right?
Yes.
And if you have anything else that you'd like to hear about, put it in the comments.
Yes.
Let us know.
Yeah,
because I think we like to squirrel out on things and go on tangents. I think we did pretty well today, actually, not going on tangents.
Mhm.
So good job, squirrels. Should we tie things up with our final closing, which is, do you remember it? You remember back at the conference how we closed it up?
Of course we do.
All right.
Totally.
Who runs the world?
All right. Catch you next